If I told you that 50% of healthy people who received the mRNA vaccine had changes in their heart function, would you believe me? This is what this recent paper seems to be suggesting, and it is fitting in exactly with what I predicted would happen. And this paper came out of the Czech Republic, looking at transient elevation of NT-proBNP after mRNA COVID vaccination in healthy adults, longitudinal biomarker analysis. And they were looking at soldiers, effectively healthy military people, some who had comorbidities because it was up to the age of 55, but generally healthy, in good health. And they did a serial longitudinal marker looking at multiple measurements of blood tests over time. This is the kind of research that we thought would have been occurring in the pandemic, but basically this paper is saying that it wasn't actually done to the rigorous standard that many people have been told. So we're going to be looking at this, but I'm coming from a different angle, and it completely aligns with this recent presentation that I did about the rising heart crisis. It's now ready as a course, including an ebook. If you're interested, look in the description below. This is really, really important because it's tying together the predictions and the science from what I've been talking about over the past few weeks and months. In case you are not aware, and my computer seems to have gotten a bit stuck here, but in case you are not aware at the moment, what we have is an issue with regards to how we look at signals. So when we look carefully at what has been happening, and this is from my presentation, these signals are increasing significantly since 2020. Cerebral artery occlusion, hypertensive heart and renal disease, myocarditis, atrial fibrillation, heart failure, pulmonary embolism. And what the study is doing is confirming the science about what we're seeing in terms of what is occurring across the population. And this is part of the reason why I have got the advantage that I can look at patterns, and you are free to look at it as well, because I've put the free description in the free link in the description, where you can look at what changed after the pandemic, looking at specific cohorts. And when we look at all the cohorts here, what's very interesting is that in the age group 30 to 44, hypertensive heart disease is at the top, 239.9, well, 240% increase. Similarly, the 45 to 59 age group as well has a hypertensive heart disease kind of pattern. And this fits in exactly with what the study is showing. So I'm going to give you some science here to help you to understand what it means. So let's break it down. Now, for some reason, I can't find my screen. It seems to have gone at the moment. What I'll do, I'll tell you what I'll do. I'll find the study itself. I'll show you the study itself, since the system is breaking down on me, and I'll show you exactly where it shows up with regards to what is happening with patients who have had their heart monitored over the period of time. You know, it's strange how the system can suddenly just crack on you at the time when you least expect it. And I think I'll tell you what, I'll try one other thing, because I had everything set up, and then now, just at the last minute, I can't find the paper that I want to show you. I just showed it to you there just a minute ago, and I can't get it again. Just give me a second. Let me see if I can find it. Essentially, what happened is that they were looking at patients or military people who had outcomes related to being vaccinated, and they followed them on a sequential look at BNP, pro-BNP. And BNP is the brain natriuretic peptide, and it's produced when the heart is under stress. So if the heart is under some degree of stress, what then happens is that it starts to increase the pro-BNP so that there can be what we call diuresis. So the body will then start to get rid of fluid, so the pressure on the heart starts to come down. It's different from the troponin, because the troponin will look at actual damage to the heart muscle. And this study didn't show any significant damage with regards to heart muscle for the heart. And let me just see here. I can't find anything at the moment that I want. Just give me a second. Don't give up on it now. I will find what I'm looking for, and I will get it all together in just a moment. Let's give it just a second, because I need to show you this detail in the paper with regards to transient increase of pro-BNP. Yeah, so I've got the paper here. So this is now the actual paper. I've downloaded it as a PDF, but I can't get to the PDF at the moment. And so what they were looking at is that the pro-BNP peaked within 14 days after the second vaccine dose. They didn't find any significant change to the troponin levels, and the findings suggest short-term myocardial stress without clinical symptoms. Now, you have to remember, this is in healthy, younger people. These are soldiers. And so when you look carefully at the cohort, they tell you then who was involved in terms of the study. So they were looking at 83 subjects, and they looked at their BNP for up to 83 days, I think, after they had been studied. They looked at 3 cardiac markers to try and understand who and what would be affected. So here's the design. So they looked at it between April and December 2021, looking at healthy adult volunteers between the ages of 18 to 55. They were military personnel at an air transportation base in Prague. And so what you know there is that they have to be relatively fit. So because it's up to age 55, you know that they may have some potential of comorbidity. But it did say none had a personal history of heart disease, dyspnea or shortness of breath, leg swelling, or renal disease. And any individuals with any acute condition were not enrolled. So they were looking at a very healthy cohort of people to try and understand what was going on. And that's very important, because a lot of people don't realize that there are changes occurring in the heart after you have looked, after you've had an intervention. And the problem is usually not in healthy people, because it's the people who are on the borderline of function that really, really struggle. So when we look at what happened in terms of pro-BNP, you can then see the numbers here with regards to what they did is they had a baseline, they had first dose, and it was about 40 days between the first and the second dose there. So they monitored 0 to 14, 15 to 29, 30 to 44. Then they had the second dose, and then they followed it again for up to 79 days in total. And at the end here, you can see it was 47 people by the end, up to 79 days. And this is the actual measure of the pro-BNP. And you can see from the baseline, within the first 2 weeks, you can see that the levels jumped from 21 to 28. Now, it's not a lot, but notice that it comes back down by the time they had reached 30 to 44. And this now is still not quite back to baseline. Then they have the second dose, and the pro-BNP jumps to 36.2. Then it comes down to 26.7 and then maintains its elevation up to 80 days after at 27.6, above the baseline. And what this is indicating is that there is some degree of stress on the heart, which is persistent over time. And as I said, you have to understand that people think that that stress on the heart means that they had myocarditis, because this is all that people hear about. Myocarditis is real, and it certainly is relevant. When I looked at the cohort analysis, and if you want to see it here, I'll show you this here again, who seemed to have the highest increase in myocarditis was the age group of 60 to 74, 237% increase in myocarditis. And in the over 75s, again, myocarditis was very top, 330% increase in acute myocarditis. So we know that this is occurring, but it seems to be in older populations. What we see when I looked at the trajectory was hypertension, hypertensive renal disease increasing in the middle-aged population. What this suggests, and again, when we look at the presentation that I was talking about with regards to the heart storm, I looked at 3 different factors that were likely to be driving these patterns. One of them was vascular dysfunction. Then there's cardiac injury, like myocarditis, and then there's regulatory instability, autonomic nervous system. The one that they seem to be seeing here is the vascular dysfunction. Blood vessel, the pressure in the blood vessels after people have had the mRNA vaccine seems to rise. My prediction is that it's because of inflammation in the large vessels, the aorta, and even in the pulmonary trunk going to the lungs. And so what then happens is the pressure increases, and that pressure leads to an increase in the brain natriuretic peptide. And this then is what we are seeing in terms of the study. And again, let me show you where the numbers are coming from. When you look at this here, I'll show you this here, this one actually. This is again showing you time frame that 8% of people had an increase above what they would consider the normal cutoff. And that was the baseline. By the first dose, in the first 2 weeks, that increased to 19%. 19% of people then, so more than double, had an increase in the brain natriuretic peptide within 2 weeks of being vaccinated. 25% of them came down, but not to their baseline. By the time you've reached 30 days, that's about 18%. 15% still had it above the normal cutoff. And by the time you reach 30 to 44 days, only 2% had an elevated BNP. Good. What then happens is they have the second dose. And then you see this surge. 45% have changes above the cutoff, of which 49%, almost half, did not come back down to normal within that first 14 days. And then you notice as we go out, it's stabilized at about 15%, 12, and 11%. This is suggesting that there are long-term changes in the vasculature after healthy people have had the mRNA vaccine. The implications of that are pretty serious, because what this means is that long-term, people don't necessarily feel unwell. And this is the problem, is that the symptoms will present a decade down the line. When the blood pressure, because this is what the BNP is likely to be reflecting here, it's not that they've gone into heart failure, it's just that the walls of the heart are under increased stress. Because the heart is having to pump harder, it releases BNP to try and get the body to get rid of the extra fluid. But guess what? After it releases the BNP, this is not happening. The pressure is not coming down, because it seems that the problem is not in the fluid status in the body. It seems to be in the blood vessel walls. They are stiffer. And I did another presentation showing this about pulse wave pressure increasing after COVID vaccination. So the two things are coming together, that you have increased pressure in the blood vessels, and this increased pressure is knocking on the heart. Healthy people will not notice the difference unless maybe they were an athlete. You know, if you were, say, a cyclist, you would probably notice that you just can't do the same times that you used to do. If you were a tennis player, you would find that you could make it to the fifth set, but you just couldn't play to the same degree of energy in the fifth set, and so you would lose. This is probably why we're seeing tennis players no longer, I mean, the older ones who used to be able to manage, unlike Djokovic, who is still playing at 38, everybody else has fallen away. So this is the kind of thing that you would notice. But for the average person, they would not notice any difference because they're not putting their heart under any stress anyway. And so this is where people will walk around telling you that there is nothing wrong, haven't seen any problems, but the evidence is suggesting that up to 50%, 1 in 2, are having changes after the second dose. We don't even know what that meant in terms of the booster dose. Suppose you then got an even bigger surge in terms of the brain natriuretic peptide, indicating increased wall stress in the heart. We don't know. And one of the interesting things that the study said, which I had highlighted in my PDF, but it's gone at the moment, it was early on in their discussion. They highlighted an important point. And look at this. This is where they say it in the paper. Only a few studies have investigated cardiac biomarkers in the context of post-vaccination adverse events. So when people are telling you that there are no problems, remind them exactly what this study has said. And now, remember, this study has only just been published in April 2020, 30th of April 2026. So this is just, and they have said quite clearly, and we agree, that only a few studies have investigated cardiac biomarkers in the context of post-vaccination adverse events. They're not looking. And so when you don't look, it's easy to say there is no evidence of, because you haven't studied it. This is therefore fitting exactly in with what I predicted. And as I said, if you look at the presentation, I'm encouraging you, if you haven't seen it yet, go and take a look at the rising heart crisis, because I break down why these things are happening and they overlap in different presentations and diseases and cases. And when you look at the presentation here, one of the big ones that I highlighted was the vascular dysfunction, the fact that the pressures are increasing, and this is putting increased risk on the heart. And again, some people may not believe that this is so. They say, well, show me the evidence. Well, here is the evidence. I've done the research when I looked at the different age groups. You can get a link to be able to see this yourself. Broke it down, what changed after the pandemic, 186 million NHS hospital admissions, looking across them. Here is what you have. The age group 30 to 44, 239 or 240% increase in hypertensive heart and renal disease. This is fitting exactly with what we're seeing. And again, the age group 45 to 59, 180% increase hypertensive and renal disease. This is significant because the trajectory indicates that this is not stopping. If nothing is done about this, I can predict what is going to be happening in the next 5 to 10 years. We are going to see a surge in heart disease, brain disease, kidney disease. Effectively, it's kind of like ignoring hypertension and just forgetting about it and hoping that nobody is affected by it. Sadly, we are at a time where everybody's health is your responsibility. If nobody is saying anything to you, it doesn't mean you are not at risk. You need to do the work, understand what's going on, and study to carefully get some kind of clarity about how you can mitigate and protect your health. I think that's the most important lesson that we have seen over the past 5 years. Sadly, I don't think enough has been done to protect the population. Too much effort has been put on protecting narratives, refusing to look at elephants in the room, and allowing longer term health issues to spread across the population without giving clarity and instructions as to what is happening and why. The reality is, the reason no one is saying anything is because if they tell you that these trajectories are increasing, your first question should be why. They may say it's related to COVID, but you say, is it just COVID? They can't answer that, because if they try and answer that, they will know that they haven't tried to clarify if this is connected not just to COVID, but the elephant in the room. And so rather than acknowledging that, it seems that science is turning their back, closing their eyes, covering their ears, walking away, and leaving you to pick up the pieces. As I oftentimes say to patients, your blood pressure is your responsibility. If you have a heart attack or a stroke, the doctor doesn't go fussing with the GP to find out if your blood pressure was controlled. It is your problem. It is your outcome. You and your family have to deal with it. And so therefore, in this situation, I will absolutely say to you, you better know if your blood pressure has been affected. Don't ignore it. Check it. Get it addressed, get it mitigated, because the longer term implications will come back to bite. Final reminder, either do the course, at least take a look at this dashboard in terms of the different age groups and cohorts. This is free for you to see the basic thing. The full thing, I'll find a way once you have given the email address to be able to share it with you. What changed after the pandemic? Every single person should want to look at this, because it is very relevant to the future of population health. Thank you for listening, and have a great evening.